is to give the students who come from disadvantaged backgrounds the opportunity to reach higher education and to consider health professions as an opportunity, with the whole purpose of encouraging these students to come back to the Valley to practice medicine in a culturally and linguistically competent fashion.
Successful because now I'm like one step closer to my goal as becoming a doctor.
When I first found out that I was accepted, I got really excited. It was something I really was looking forward to, and I worked really hard to get into.
I'm still interested in many. I'm slightly leaning toward a general practitioner. What got me interested was a son of my mom's really good friend. I consider her cousin. He was a nurse at the time when my mom had slight stomach pains, and the way he was able to speak to her in Spanish, most doctors couldn't, and the nice way he treated her inspired me, and from then on I really want to become a doctor.
I come from a really poor family, so then health was always the issue. My parents they were always struggling of what medicine to take, how much should we take, so that led me to becoming interested in pharmacy.
I got interested recently in anesthesiology from auditing one of the surgeries, so I just got to experience what it is like to be an anesthesiologist and kind of see their role and how important it is that they evaluate the patient, how important it is that they keep the patient asleep, because no one wants their patient waking up during a surgery.
It helped me as a student because it encouraged me, since I want to be a surgeon, to continue working hard and to never be discouraged by others like how I was before.
It brought up my grades a lot, because I wasn't a straight A student at first, and it was just like nothing but B's, maybe like one C, but it helped me a lot. I learned a lot more.
It's helped me open doors to opportunities. I got to meet different people, different medical assistants, doctors.
Thank you for always being there and for really understanding what I'm going through, because it can be hard sometimes, but it's worthwhile when you have someone there.
Message for parents is to please listen to your student when they ask or want to tell you something of importance in relation, especially when it comes to the internship, because it gets really difficult in terms of transportation and where they're going, what they're doing. Those need to be clarified beforehand so no mishaps happen along the way.
Sentí mucha emoción y sorpresa a la vez porque sabía, estaba informada que no todos los niños que quieren estar ahí pueden lograrlo. No porque no estén preparados, sino porque no hay muchas oportunidades.
And the success, of your children and the DA also depends on you as a parent, and just like I said, giving them the support they need, because that is so big. Because they can't do it alone, and they are learning as they're going, and they're growing. It's a 4-year program, so you can see kind of how they grow from freshman to senior, and at the end, it's just amazing. Very proud.
It gave him so many opportunities. He's grateful. I'm grateful that this program does exist. And I hope that it's around for a long time.
I feel that with Doctors Academy and going through the whole AVID process as well, I was academically prepared when I went into when I entered UCMER. Part of the reason is all the requirements that we were given during in the program, and they prepare us well by making sure that all of us are taking AP classes and making sure that we have all the resources that we can to make us successful students to enter college. And I feel that I was really prepared in that sense.
Being in this program, it pushed me to take more AP classes, which I don't think I would have otherwise taken. The biggest plus was shadowing the cardiologist end of my junior year with this program, because there were many opportunities at UCLA where they require prior experience in like volunteering at the hospital or getting a research position. So I was able to use this experience, and it kind of helped me get that position.
Take every advantage of the Doctors Academy that you can. Take this, especially this research project, take it really seriously. Ask lots of questions. Be curious. Don't be afraid to look dumb. Everyone asks those seemingly obvious questions, and those are the people that end up advancing more than the others.
Giving back to your community is very, very gratifying. I love to do outreach and recruitment. I get many calls from elementary schools and high schools, colleges, and I love doing that. I love going out and just letting people know that if I can do it, I'm a guy from Raisin City that went on to Carruthers High School, that went on to Fresno State, that went on to UC San Francisco, and then here have a practice of 12 years. I mean, if I can do it, then anybody can do it.
I'm extremely satisfied. I'm a community pharmacist, which means that I work in a community pharmacy, and it's a setting where patients can just come up to me and they can ask me questions and they don't have to pay for it. So it's a free service that I'm able to provide. The area where I work, it's a very dense Hispanic population or Latino population that lives there, and I'm able to communicate fluently with them in Spanish. And that's one of the reasons that I'm so excited and so happy to have chosen pharmacy, because I'm able to make a difference in a lot of people's lives that I probably wouldn't have been able to do otherwise.
I think that the pipeline experience that I had was a wonderful opportunity. I was given the ability to take multiple rigorous courses, and it was required. So I didn't really have the opportunity to back out of it. It was one of those required things that prepared me so well for being at an Ivy League. The other thing it gave me the opportunity to see was continually going to multiple university campuses and seeing higher education and how that was just a normal thing. So it was a natural thing to go on to a university and challenge myself to get to the best university I possibly could.
Number one is hard work and working smart. I don't care what you're doing in life. If you're not working smart and you're not working hard, it's going to be hard to live a life of significance. The second thing is, having a great attitude. I think in this world that we live in, so many times we're so focused in ourselves and not necessarily the others around us, and sometimes we don't pay attention to how our attitude affects others. So having a really positive attitude and just having a good energy around you is really, really is necessary. And the last and final thing that I think is the most important is that you have to have God in your life. You have to have salvation and feel like you're in a place, this is your calling, and that you've been blessed to do it. And I feel if those three things are in line with one another, there's no reason that you shouldn't live a life of significance like I've been fortunate to.